If you're above the age of 24, I hate to break it to you, but your brain, according to a new study, is already on the decline.
So sad. Well, that's just one of the big health headlines that caught our attention this week. Here to break them all down for us is internist Dr. Keri Peterson and emergency room physician Dr. Sampson Davis. Good to see you both.
Good morning.
Good morning.
So a study broke last night that found that short home videos, like those posted on YouTube, may become a powerful tool in diagnosing autism. Dr. Peterson, why is this effective?
Well, it's really fascinating. The home videos were a tool that aided non-trained students to be able to identify patients as being autistic earlier on. They actually showed YouTube videos to students and it allowed them to identify red flags for autistic behavior, such as repetitive behavior, not making eye contact, not playing with toys inappropriately. And it was found that these students could 97% of the time accurately identify children that were autistic. So this could be a wonderful tool to aid physicians in making a diagnosis earlier, because right now the average age of diagnosis is about age 4, but the ideal treatment time to initiate is about age 2 to 3.
So what are the symptoms and signs then that they were looking for?
So they were looking for things like being able to maintain eye contact, which is an important tool, poor language skills, repetitive behaviors, not playing with toys in an appropriate way, and not responding to social cues the way a normal child would.
Right. I think what's key is what Dr. Peterson mentioned too as well, is early intervention, because the earlier we intervene and help to treat kids with autism, the better they do long term in sort of adapting and adjusting with the ailment.
Kind of watch kids, watch YouTube. That's very interesting. Dr. Davis, let's look at this next one. I mentioned it in our lead-in. Cognitive decline could begin as early as 24 years old.
So that's scary. So this study takes into account using video games as well, that as we get older, we lose the ability to concentrate and sort of multitask. And they think that as early as 24 years old, this can happen. Now, the problem that I have with the study is a very small decline that they noticed at 24. And then the next age that they measured was 15 years later. So yeah, by 40, you should have a little bit of a delay. But what's good about the study as well, what was promising, is that although we lose some ability to maybe focus or concentrate, that we're smarter at sort of taking the issue at hand and making decisions. So whatever we're challenged with, we use experiences from before to sort of make a rapid decision. Although it may be a little slower, a little delayed in making that decision process, we use our past experience to sort of shape our goals or make the decision based upon the question at hand.
We can gain some new skills as well then, based on that.
In a way you can, but also we use what we have in place in order to make a decision, and that's good. So we lose a little of ability and sort of the rapid response in what we're thinking, but at the same time, what we have in place from previous experience we use to make the decision based upon information that's being presented to us.
Okay.
All right, our next one, at least 1 in 20 adults, Dr. Peterson, is misdiagnosed at an outpatient clinic in the United States every year. That's a big number.
Yeah, this is a new study that just came out. It's very hard to assess how often misdiagnoses are being made in an outpatient setting. In hospitals, it's easy. You can look at infection rates or in falls. But this study was able to extrapolate some data for us by looking at 3 arms. One was mistakes made in a primary care setting, and one was delay in diagnosis of colon cancer and lung cancer. And it found that about 5% of the time, there is a delay in diagnosis for patients with these issues. So it's about 12 million Americans, and about 6 million of those are potentially harmful outcomes. So it's a wake-up call. It's potentially opening the door to tune into where along the protocol are physicians making these errors. How can we improve the quality of our health care?
So then the big question is, how do you become more proactive when you go to the emergency room or an outpatient clinic then?
Correct. Well, this is predominantly looking at the outpatient clinic, and it's really the first of its kind on such a large scale to really identify how often misdiagnoses is actually happening. So it really is more of a wake-up call, and it will potentially raise eyebrows to now pursuing how do we intervene and correct the problems.
All right, good information, Dr. Peterson, Dr. Davis. Thank you both so much for those